how do biofillers work? Well, they're really elegant. It's a really elegant system. And the way that I'm going to do my best to describe it to you without getting too weighed down in the science. But our body has regenerative capacity. We know that. Our body has the ability to regenerate. And a lot of the growth signals that tell our body to regenerate are carried around in our platelets, which is why PRP has become such a thing. When we take platelets from a person's own blood and inject it into some kind of tissue, we inject knees, shoulders, we do it for hair, we do it for skin, the platelets induce the tissue to regenerate. The problem with PRP, though, has always been it's a liquid, right? You inject it, it's there for 5 minutes, and then it gets washed out by the bloodstream. So the signal is short, and there's only so much regeneration you can get with a short signal. The reason why biofillers are so cool is that they have come up with a way to both give structure to the skin and also turn that signal from a short signal lasting a day or two if you're lucky to a signal that lasts 4 to 6 weeks, which induces exponentially more regeneration. And the way they do it is this. We draw the blood, we spin it in the centrifuge, we take the plasma. We split the plasma up, we keep the PRP, we keep that to the side, and then we take all the rest of the plasma, we heat it up in that heating unit that's on the counter, and we make it into this gel that has a structure and a heft that's very similar to HA filler. Then we mix the PRP back into that gel. So the way I think of it, now we have like a cake with raisins in it, right? We have this gel, and all throughout the gel are all these little platelets. There's and they're embedded in the gel. So then we inject that. When we inject that, the gel gives the tissue structure. So that gives us that filler-like effect, right? As the gel is breaking down, you can imagine that cake being eaten, those raisins that are in the cake are being released one at a time, gradually over time, as it's being broken down by the body. So you get this immediate structural response, and then this long, slow, even regenerative signal that's just sitting in the skin, just being like, okay, regenerate, regenerate, regenerate. It's like going to the gym for 6 months instead of having like one huge workout one day. That is why this is fundamentally different from any other PRP treatment that has ever been out there in the world. It gives you a sustained response because the PRP is embedded in this biological gel that stays put. And that's the key to it. So that's why you can get both structure and regeneration both from the same tool. Combinations. Solenis, the thing about BioFiller is, I think of it like it's like fertilizing the soil, right? In that first couple months when it's in the skin is being regenerated. It's getting all these growth signals. So it's like the analogy I use, if you're going to the gym, like if you had a regular laser, that's going to the gym. It's good for you, without a doubt. But if you're eating an incredibly awesome diet and getting good sleep and low stress and all those things, and then also going to the gym, you're going to get a much better result. The same is true for BioFiller and any other skin regeneration tool. The BioFiller is like preparing the skin. It's giving the skin that good diet, taking away the skin's stress, and then we add a laser on top of that, you get 2 + 2 = 6. It's really, really wonderful. So you don't combine Solenis with anything day of, except you could do tox, but you don't combine it with any kind of skin treatment day of. But 1 month after a BioFiller, every patient should be getting some skin regenerative tool. And really that's microneedle, microneedle RF, or advanced skin resurfacing, because the results they get from it during that window, they have this window of time where the results are going to be exponentially better. And so we want to encourage that. And really, microneedle RF or skin resurfacing. Those are the two things that are going to give the biggest bang for the buck. So it should be BioFiller, microneedle RF, or advanced skin resurfacing, and then second round of BioFiller. And that combined package is going to give patients our best results hand out. So who is a good candidate? The short answer is everyone, but there's also a more nuance to it than that. So generally speaking, the younger someone is and the healthier someone is, the better the quality of their plasma. So people who are in their 30s and 40s are going to get a better response from this treatment. They'll get 2 rounds and they'll be good to go for a year. Somebody who is maybe not as healthy of a 40-year-old, definitely when you get into 50s and 60s, they're going to need 3 rounds in order to get that sustained result. So it's something to know. It's not that the treatment is not as good in people who are older. It's just that people who are older, the same as a 20-year-old can go to the gym once a week and be in incredible condition, right? If you're 50 and you want to be able to run a marathon, you need to be working out like every day, right? Because your body does not respond as well to regenerative signals. The younger and healthier someone is, the less they need. The older and less healthy somebody is, the more of that signal they're going to need to get the same result. So everybody is a good candidate, but make sure that you tell people who are older and less healthy that they are going to require more like 3 or 4 rounds instead of 1 or 2 rounds to get the same sustained result. Aftercare, just don't mess with it. You're going to be a little bit swollen. You're going to be a little bit bruised. You can massage the areas. If there's lumps, you can massage the areas with your fingertips. Put a little moisturizer on your hands so your hands glide over the skin so you don't like abrade the skin. But you can massage areas of lumps for a couple minutes a day, several times a day. That will help them go down more quickly. But just know that they are going to break down over the course of a couple of weeks, not the course of a couple of days. The lumpiness does not go away quickly with biofillers. That's the one thing that everyone needs to know. But other than that, no hard pressure to the areas of treatment. So that's no massage tables, no ski goggles, no swim goggles. Nothing that's going to push hard on those areas for 3 or 4 days because that can move the filling around, and you don't want to do that. What areas can we treat? This is going to be primarily used face, neck, décolleté, and hands. Theoretically, you can treat any area of the body, but those are the areas where visible volume loss is tends to be the most distressing to our patients. So generally, face, neck, décolleté, hands. The skin types, any skin type, you can treat any skin type with this. It doesn't matter. Pregnancy and breastfeeding. You can absolutely do this in somebody who's breastfeeding. Pregnancy is a contraindication to everything just because they're pregnant. But pregnant ladies, their weight tends to fluctuate over the course of the pregnancy, which makes it hard to judge contour. So only after they have delivered and when they are back to what they feel is a stable weight, which different people, that's different amounts of time. Some people that's 2 weeks, some people that's 3 months. But when they are at what they feel is a stable weight, that's when we can go ahead and start doing these treatments again. Sun exposure doesn't matter. I mean, for all things, generally you should always wear sunscreen, you should always wear a hat, but sun exposure doesn't impact this treatment at all. And antibiotics, again, doesn't impact this treatment at all because it's not a laser. So those are the things you need to know about biofiller treatments.